Good morning, everybody. My name is Eduardo Sanchez. I serve as the Chief Medical Officer for Prevention at the American Heart Association, and it's really so good to see people three-dimensionally. I hope you all agree. For those of you who are not three-dimensional, we're happy to see y'all as well, but here we are in person for this year's Foodscape Innovation Meeting. A couple of housekeeping things that I want to share. This is being video recorded, and those presentations will be shared publicly without the QA and discussion. We would love for all of y'all to participate in the QA discussion. Virtual participants, those of you who are watching from somewhere else, please use the hand feature so that we can have you participate. And one last thing is that oftentimes we have something to say and there isn't the time or the opportunity, or we have something to say and we don't have the personality to get up and say it. So we've got these posted bulletins, I don't know what they're called, idea boards, and there's 4 questions on them. And so throughout the day, if you think about something that maybe falls there, and I would say to you, even if it doesn't, something that you feel would be a meaningful contribution that perhaps you don't have the opportunity to share, the 4 questions are: what surprised or inspired you today? What would meaningful progress look like in 1 year? What are we collectively reluctant to address? And what next steps could leaders in this room take? So as we think about this notion of not only food innovation, but food security, the day is going to be packed with opportunity to hear some hopefully thought-provoking thoughts, concepts, solutions, and I'm very much looking forward to the day. As I thought about preparing for today, there were a couple of things that I came across that I thought might be a good way to get started. You will recall that in 2019, the Lancet Commission put out a report, the EAT Commission, that challenged in a way, but said it is possible to achieve food security for all with healthy diets and environmental security for the planet. I do think that a notion that we all need to think about is food for health, not only for the health of individuals, but food for health in a way that maintains our ability to live on this planet. There are some headwinds. The long-term headwinds around which we can prepare include climate change, and include a growing population. I can remember at so many parts of my life, population growth was the thing to worry about. Population continues going up, but the Lancet Commission believes that there is the possibility of achieving both feeding a growing population and protecting the health of the population. There are some short-term headwinds as well. These are the realities that some people are living every single day. We've got the effects of COVID, and I'll talk about that for 1 second. We've got the effects, and that's the effects of COVID on food security, let's be clear. We've got the effects of inflation. So right now, what maybe a year ago was a more food secure situation for many families has gotten a little bit more precarious. Then we've got a war going on in Europe that has absolutely, in the short term, threatened what will be in the intermediate term the food security of many on the planet, and perhaps people in this country in the form of inflation. One of my favorite quotes, and I'm going to close very soon here. You know what, I'm going to come to that quote right when I close, because a very recent article in the American Journal of Public Health, May 2022, Bortoldo et al., title is Food Insecurity and Delayed or Foregone Medical Care During the COVID-19 Pandemic. And I am sure that all of you have read, are fluent, are conversant in the disproportionality that was manifest during COVID-19. Persons of low income, and particularly persons of certain underserved race ethnicity groups, particularly Black Americans, Latino Hispanic Americans, American Indian Alaska Natives, some of the subgroups that are all lumped together into Asian American, all suffered in some form or fashion food insecurity, lost jobs, kids who weren't able to go to school, and in many instances and in many cases, communities figured out some ways to get that addressed. But this article suggests with data that disproportionality of food insecurity exacerbated the delay or foregoing care that we saw happen in the United States. You may or may not know that not only did 350,000 people die approximately of COVID-19 in 2020 as compared to none in 2019, but in virtually every category, cardiovascular disease, stroke, diabetes of note, there were increases in the number of people who died from 2019 to 2020 due to those conditions, probably a reflection of delayed care, foregone care, or care that wasn't rendered because hospitals were overwhelmed. So I bring all that up to say food is integral to so much of our lives. It is what we at the American Heart Association have put as one of the 7 elements of life, Simple 7, the 7 factors that contribute to cardiovascular health. But there are also the 7 factors then that, when not optimized, contribute to disease and contribute to ill health. So I leave you with my favorite quote for today anyway, and that's Hans Rosling, who, when he was alive, said, I'm not an optimist, but I'm a very serious possibilist. And the tools are in front of us. They're right there. What we have to do is put them to work and know how to put them to work. And so what I hope is that today, through our discussions, through our deliberations, through our Q&A, through your opportunity to put your thoughts on paper if you're not willing to share them, we move at least this group towards putting on paper what might be possible. So with that, I am going to introduce our first speaker. Today, I'm going to do very, very short introductions. All of these folks are, the introduction will be kind of like the one for myself. I'm short, you don't know where I went to college or anything like that. Go look it up. All of these, many of these are folks that I know well and have had the opportunity to work with. Dr. Ann Thorndike is currently associate professor at the Harvard Medical School. She's a physician at Massachusetts General Hospital. And she is she was the AHA Nutrition Committee Chair and lead author of the AHA Policy Statement on Strengthening U.S. Food Policies and Programs to Promote Equity in Nutrition Security. So that is what she's going to talk about, advancing equity and nutrition security in the United States. Ann, please.
I just wanted to say I'm so happy to be here and to be able to talk about nutrition security today. It's been really a journey for myself to work on this topic. I have done many years of research in the food environment to promote healthy choices, and in the past several years have focused on social determinants of health. And then I really, the two concepts of food insecurity and promoting healthy diet have come together for me personally in my work. And so I really was excited about the opportunity to participate in this AHA policy statement on nutrition security. And these are my disclosures. So the concept of nutrition security is nothing new. I mean, this is something that has been on the world in the world perspective for many, many years. But recently within the US, within academic circles, there's been a lot more discussion about this term nutrition security. There was a viewpoint published in JAMA in I think it was 2019. We had our AHA policy statement. The USDA just came out with their statement on action and nutrition security. I think that now that we have a label for it, I think that it's important to kind of understand what we mean by nutrition security. So a lot of today is I'm going to be talking about how we came to define nutrition security in the process of putting together this paper, and where we think policies and programs can advance nutrition security, with the caveat that this is that we wrote this statement with the knowledge that current US policies and programs are doing a lot for nutrition security. This is not to say we aren't doing a good job, but we can do better. And this is what the statement focused on. And then at the end, this is not part of the policy statement, but I have a couple slides about how the food industry can think about improving nutrition security, because this is something, it crosses over with a lot of the work that I've done, a lot of the literature that I've reviewed over the past several years. And so it would be a good place for discussion at some point today. So if we're going to talk about nutrition security, we should define what we mean by food insecurity, nutrition, and dietary quality, because nutrition security brings all of these concepts together. So food insecurity is a household-level economic and social condition of limited or uncertain access to adequate food. Whereas nutrition is the interaction of nutrients and other components in food and beverages as they relate to growth, maintenance, reproduction, health, and disease. Dietary quality is a healthy overall dietary pattern of total food and beverages consumed, as outlined by the US Dietary Guidelines for Americans, in addition to actually the AHA dietary guidance that was published last November. So why is this important? Why is nutrition security important? I think these maps of obesity and diabetes, which are the #1 diet-related diseases, the most proximal diet-related diseases that we have, really demonstrate what's been happening in the US. And so not to pay too much attention to all the different colors, except for this dark purple color, which is the highest rate of obesity and diabetes. That means that in those counties, diabetes is greater than 10.5%, so more than 1 in 10 people have diabetes, and more than 1 in 3 people have obesity. So here's 2004, here's 2009, and here's 2019, the most recent map. And just kind of, if you can kind of squint, you might see a little bit of a pattern there where there's a really more purple in the south. Actually, northern Maine is where you see some, a little bit in the southwest. And so as you think about that, think about, this is a map of the prevalence of food insecurity in the United States. And so some of those areas cross over where there's high prevalence of obesity and diabetes, and there's higher than the US average in food insecurity. But only just a few states are below the US average, and many states are around the average of 10.7%. And if we think about we want to think about the demographics of food insecurity. Certainly households with children are more likely to have a higher prevalence of food insecurity, and particularly those households with a single woman as a parent. Black, non-Hispanic, and Hispanic households are the higher prevalence of food insecurity, and of course those households with a higher poverty level. And as far as diet goes, low-income Americans have a lower overall dietary quality and consume decreased fruits and vegetables, decreased whole grains, increased refined grains, increased added sugars, and increased saturated fat compared to the Americans with a higher income. So this, just in the red bar at the top, is the total healthy eating index score, which is a score from 0 to 100. 100 would be a perfect healthy diet. 0 would be the worst diet. And so for overall, Americans, it is around 59-60, but those who have low income, less than 131% of the poverty level, it's 56, compared to those who are greater, that have a level of 60. And if we look at racial ethnic groups, Black Americans have the lowest overall dietary quality. If you go to the red bar at the top, non-Hispanic Blacks have a healthy eating index score of 54, compared to 57 in non-Hispanic whites and 65 in non-Hispanic Asians. And actually, Hispanic Americans have a dietary quality that is actually a little slightly higher than white non-Hispanic Americans. But among Black Americans, again, it's the lower dietary quality is driven by consuming fewer fruits and vegetables, fewer whole grains, and increased added sugars. So with all this in mind, when we spent a lot of time in this policy statement thinking about what is the definition of nutrition security. So there's a lot of definitions that are out there, and what we like to think is we really built on what's been done and added a few things or combined a few definitions to make what we thought was a definition that really captured what nutrition security is. So in our definition, we define nutrition security as having equitable and stable availability, access, affordability, and utilization of foods and beverages that promote well-being and prevent and treat disease. Now, this is a bit of a mouthful, but we felt that these, and I'm going to go through each piece of how we put this together. But the key words are equitable and stable, and then available, accessible, affordable, and utilization. And we took it beyond other definitions to say we think that we should get to the point where we're able to prevent disease, not just treat disease. And this is how we depicted it in a figure. And so the idea is that we would move from addressing food sufficiency to nutrition security. So food sufficiency just means if people are hungry, you get them food, any kind of food. And in nutrition security, we're hitting all these marks of making it available, accessible, and helping them utilize the food and making it stable over time. And this takes us from health disparities to more closer to health equity, at least with diet-related chronic disease. So let's talk about the different components that were included here. So the first is availability. So availability means that all communities have sufficient quantity or calories of food and appropriate quality or nutrients of their food. Accessibility means that the nutritious foods are obtainable by everyone, meaning individuals of all physical and mental conditions and in all geographic locations. And the other important point of accessibility is that nutritious foods are acceptable. That means that the foods that people have accessibility to must align with their cultural, social, or other dietary preferences, because otherwise they're not going to consume those foods. And foods must be affordable. Individuals must have sufficient resources to acquire nutritious foods, and nutritious foods need to be available at a cost that can be purchased by all. So this other component, utilization, is really what I think that is something that we added to the definition of prior definitions. Utilization is included in the United Nations definition of food and nutrition security, but it has slightly different meanings on a global level. So we really thought about what does utilization mean in the US and how, what are some of the factors in utilization that are impeding people from achieving nutrition security? So the first one is physiological, and that means you have to be healthy enough to consume a healthy diet. You have to be able to chew, digest, and absorb your food. So on a policy level, there's not a lot we can do about that. But these other factors are things that we should be thinking about how we can make changes. So to utilize food, you have to have adequate food storage. You have to have a refrigerator. You have to have containers, dry spaces. So if you're homeless, you're not able to do this. If you are living in just a motel, you might not have appropriate food storage. So that could be an issue. Another part of utilization is preparation. So preparation, yes, you need the kitchen tools and equipment. So that's one piece. But beyond that, to prepare foods, you actually have to have the knowledge. You have to have the culinary knowledge to know how to prepare foods. You also have to have the time. So if you're working several jobs or you have multiple responsibilities, you might not have time to prepare the food, and that's going to affect your utilization. So if people are getting a box of fresh fruits and vegetables, that's great. We've given it to them there. It's accessible. But if you don't know how to prepare it or you don't have the time to prepare it, then you're not able to utilize that food. Another aspect of utilization is intra-household distribution. So in some households, a lot of times the parents will prioritize the children over the adults getting the nutrition in the house. So that's one aspect that needs to be considered. Older age can be associated with social isolation and decreased mobility, which might affect your ability to get adequate nutrition. And then another slightly more abstract concept is around social stigma related to poverty or race and ethnicity that affects program participation. So people may feel stigma about participating in SNAP or WIC. It also factors related to structural racism and targeted marketing affect what people consume. And then the final component of nutrition security is, of course, stability, that this nutritious foods needs to be available over the life course. This is consistent with the US dietary guidelines that emphasize the healthy eating patterns at every stage of life, and also maximizing the utilization of nutritious foods across the life course through nutrition education, policy, systems, and environmental approaches that can improve stability. So in thinking about advancing equity and nutrition security, there are several aspects, policies, programs, and systems that we can think about, including federal and state policies, the charitable food system, the healthcare system, and the food industry. So I'm going to, in our statement, we talked about some federal and state policies, charitable food system, and the health system. I'm going to give a few examples here. And then, as I said before, I'm going to talk a little bit about how the food industry might play a role. But before I talk about specific examples, I just want to talk about some of these overarching principles that we also came to as in the course of putting together this paper, that as we thought about all these policies and programs, we kept coming back to these same principles that we thought that were important throughout each recommendation that we were making for them. So there were 8 principles that we summarized. The first was that we need to ensure nutritional quality in all of our programs by adhering to nutrition standards. So the National School Lunch Program does have nutrition standards, but not all the programs have nutrition standards. We need to improve reach by increasing outreach and simplifying enrollment. A lot of the food assistance programs have difficult enrollment processes for many people that make it hard for them and create a barrier. We want to ensure optimal utilization of these programs by all participants and improve coordination across the different programs. Another principle is that we want to ensure the stability of access to programs across the life course so that there's no gaps in care over time. Ensure equity and availability, access, affordability, and utilization, including the provision of acceptable foods in all of the different programs. Ensure dignity by reducing stigma associated with participation. And then finally, and this is an important one, we felt that it was very important that we develop and implement a national measure of nutrition security in the US so we can follow it over time. Okay, so in the course of this statement, we made several recommendations for different policies or programs to improve nutrition security. So I'm going to just talk about a few of them. So SNAP It's a program I'm sure almost everyone is familiar with. And this is available to eligible low-income households, adults and children, and provides a monthly cash value on an EBT card. And it covers almost all food and beverages except for some hot prepared foods and alcohol. So our recommendations focused on providing incentives for nutritious food purchases like fruits and vegetables, and possibly disincentives for sugary beverages and junk foods. So there is literature, there's studies that demonstrate that this has potential to be an effective strategy for changing the way people are purchasing their food. We also recommended strengthening requirements for SNAP retailers to stock and market healthy foods. So the next program is the WIC program, which is for pregnant, postpartum, breastfeeding women and children less than or equal to 5 years old. This also comes as a monthly EBT, but it's for specific food items and in specific quantities. And these food items align with the dietary guidelines for Americans. So it's not the same as SNAP. So for this program, we recommended to improve the reach and improve the reduce gaps in coverage by extending eligibility from age 5 through age 6. So this covers children who age out of WIC but aren't quite ready to go to kindergarten. So there is this 1-year gap for many kids. So if it covered through age 6, it would reduce that gap. We also recommended permitting states to certify infants for 2 years instead of 1 year. This is also decreases that barrier to enrollment, whereas people might just not recertify because it's a pain in the neck to have to go do that. And we also emphasized maintaining the increased cash value voucher for fruits and vegetables. And then the last federal program that I'm going to talk about is the Food Distribution Program on Indian Reservations, or FDIPR. This is also funded through the Farm Bill. It's slightly different because it's administered by the USDA and tribal governments. So this program is the participants are low-income tribal households on Indian reservations or living near them, but they're not on SNAP, and they get a monthly food package. So our recommendations were to expand the inclusion of more traditional and native produced foods to make foods more acceptable, expand the role of the tribal governments in administration and procurement decisions, so allowing them to procure more locally produced foods, and allow the use of both FDIPR and SNAP in the same month, which would increase the ability to purchase more food. So another area we talked about was the charitable food system, which is fed by federal, state, and local or private funding. That includes all adults and children who have food insecurity, so there's no strict requirements for participating. And the charitable food system in general provides groceries or meals at no cost. And this is done through food banks that provide the food to food pantries or to meal programs. So our recommendations focused on providing more federal support to assess and communicate the nutrition of food using standards. So the Healthy Eating Research nutrition guidelines for the charitable food system were published in 2020. This provides guidance for basically labeling the foods within food banks as red, yellow, and green to identify what are the healthier choices, so that when food pantries order from the food banks, they know which foods are a healthier choice, and so that they can minimize their less healthy choices for their clients. And we also recommended providing more federal support for programs through the charitable food system that would be addressing chronic disease, such as providing medically tailored meals through food pantries. And I'll just touch base a little bit on healthcare. I think we actually have a session on healthcare today. So we talked about Medicaid funding for programs to address food insecurity and nutrition. So Medicaid allows state waivers for the states to innovate programs to address food insecurity, among other things. So one example of this is in my state, Massachusetts, we have the Mass Health Flexible Services Program that provides funding through the Medicaid ACOs to address food insecurity and nutrition, as well as housing insecurity. So in the future, we recommended that CMS provide funding to improve nutrition through specific interventions such as medically tailored meals or groceries and produce prescriptions, and that to expand this so that states don't have to apply for waivers to do this type of work. Okay, so this is where I'm going off the statement. I'm going into my own opinions here. I think there's many opportunities to address nutrition security within the food industry. And I know many of you are representing the food industry, so you may or may not agree with me, but I'm gonna put it out there. This is kind of some ideas that I've thought about over the past several years. So I think that there is no doubt there's opportunities for innovation around formulation of foods that are both nutritious and affordable, as well as innovation of nutritious and affordable prepared foods. I don't think we talk about the prepared foods as much. They get a bad rap because people are always saying that associating prepared foods with processed foods and associating processed foods with unhealthy foods. But I think that we should be thinking that to be realistic, people just don't have a lot of time right now. So if we could innovate more around developing prepared foods that are healthy, that people would make it easy for people to be able to prepare relatively healthy meals for their families and that are affordable, that would be a great step forward. I think making supermarkets accessible to all neighborhoods is important. I think that it's not a cure-all. I think a few years ago, everybody thought that was going to be the answer. Just put a supermarket in a neighborhood and we're going to improve the nutrition. I think it's way more complicated than that. But we still need that to check that access box. But other things will need to happen, including ensuring that in-store and online retailer marketing practices are promoting healthy options and not just promoting the unhealthy options. Other areas for the food industry could help move forward is ensuring that front of package and menu labeling clearly conveys nutritional value and is not misleading. And I think that there are some examples of how people get misled from front of package labeling, especially around beverages and juices and those types of things. Avoiding targeted marketing of unhealthy food to low income and racial ethnic minority populations. I'd love to hear people's thoughts on this, but I think that this is an issue that has been written about recently. It's something that's similar that happened around tobacco. And I think that it really does lead to disparities in how people choose their food in the supermarket. And I think improving partnerships, and I'm sure many of you are already partnering with the charitable food system, some with healthcare systems, but I think more partnerships to promote nutritious foods within the charitable food system, as well as partnering with healthcare systems to really implement these medically tailored grocery and produce prescription programs would be really beneficial. And so I'm just going to end with this slide and say that through this work, we are trying to move from health disparities to health equity through improving nutrition security. I think we all have a role to play here in each of our wherever we work, whether it be in healthcare, in the food industry, in government. And I think, I think there's a lot of possibility here, as Eduardo was saying. So I'll end there, just thanking and acknowledging my co-authors and the AHA staff that helped with the statement.